Professor Fabririzo Bert from the University of Turin.
Okay, thank you very much and good morning, everybody. I'll try to answer the following three questions in the next few minutes. First question, is it appropriate to focus on older adults? Well, according to epidemiological data, we can answer yes. In 2019, in high-income countries, we observed among around 5 million cases of RSV in adults aged more than 60, around 500,000 hospitalization and more than 30,000 deaths. The estimate incident in these countries is relevant, and this is probably an underestimated issue because we know that there is a lack of specific surveillance systems about RSV, especially in the elderly, in the older population. So all the data that we can see today is not probably representative of the reality. Another consideration is about the population that are at higher risk of infection or severe illness following the contact with RSV. In particular, we know that infants and young children, immunocompromised patients, older adults, and actually all the adults with specific medical condition are at higher risk. These medical conditions are diabetes, asthma, cardiovascular diseases, cerebrovascular diseases, chronic kidney diseases, and so on. It is important to collect epidemiological data, and how we do it in Italy. We got an Italian surveillance system called Respiratory that started in the season 2019-2020, and it is part of an integrated surveillance system for influenza-like illnesses and respiratory viruses. This is possible through the collaboration of general practitioners, pediatrician laboratories that are coordinated by the Istituto Superiore di Sanità, Higher Institute of Health of Italy, and supported and funded by the Ministry of Health. We can see in this slide an example of data collected that are from the last season, and we can see that RSV is the most frequent, is one of the most frequent virus in our population, especially in the young children, but also in older adults. Another aspect of appropriateness of prevention in older adults is represented by their increased vulnerability. The phenomenon is known as immunosenescence. In few words, our immune system with the age become less effective. We must consider also that older adults often live with and die for several chronic conditions such as stroke, ischemic heart disease, respiratory disease, diabetes. This condition can exacerbate RSV complications, but RSV can also worsen this specific condition. This is important to acknowledge in order to understand the need of prevention in this age group. No less important is the fact that on average, more than 158,000 RSV-associated hospitalization occur annually among adults, and 92% of this hospitalization occurs in older people, in adults over 65, especially the oldest one. Reducing complication and hospitalization can alleviate the burden on healthcare system due to the overwhelming high demand of intensive care care, especially during the seasonal outbreaks. This is important because we know that RSV causes hospitalization and loss of autonomy. Finally, another aspect of appropriateness is represented by the availability of vaccines. CDC, but also other international organizations, recommends a single dose of any authorized vaccine for all adults aged 75 and older, and for adults from 60 to 74 years at increased risk of severe infection. Prevention on these people is important since they often live in family or communal settings like nursing homes that Jesus before mentioned, and the risk of transmission in this context is very high. This leads us to the second question. To what extent are young people carriers? Well, we know that young children, especially under 2 years of age, are often the most affected category by RSV, experiencing symptoms ranging from the common cold to more severe illnesses such as bronchiolitis and pneumonia. Since RSV spreads through respiratory droplets or contact with contaminated surfaces, it is easy to imagine how these young children, maybe in their grandparents' arms, can serve as carriers of microorganisms. Another issue is represented by the fact that older children and adolescents are often asymptomatic or with mild symptoms, but they can transmit the virus to their oldest ones. So it is important to know that, because these young people usually are less mindful about hygiene prevention, like, I don't know, hygiene practices like hand washing or avoiding close contact. And so they are potentially carriers of microorganisms for their family and older people. This is more true if we consider that they attend at school, daycare center, group activities with a lot of social contacts. People with RSV can spread the virus for up to 2 days before they feel sick, and may be contagious for 8 days after the development of symptoms. This means that we know that infection rate in childhood is high, and especially in children under 2 years old, and these children can be infectious for 1 to 2 weeks and can infect their families. There are some literatures about it, because we know that some epidemiological studies provide evidence that there are household outbreaks. There is a possibility, but due to the underreporting of RSV cases caused by the lack of effective surveillance systems, the data should be interpreted with caution, because probably are underestimated. So, third question. What contribution can research make in light of these preventive needs in the elderly? We are in a group of age where the burden of disease related to RSV is particularly significant, yet the immune system response capacity is reduced. The driver of transmission find fertile ground due to the specific condition of this subgroup, and this is the reason why the immunization strategy and active immunization is very important. And we got possibilities in this field, because we got monoclonal antibodies currently used for the prevention of infections, especially in newborns and in the first months of life. But we got also vaccines designed for adult population, especially pregnant women and older adults, or adults with specific chronic condition. And in the field of vaccination, we got several possibilities about production approaches, because there are trials about mRNA vaccines, about protein-based vaccines, and finally about vaccines using chimeric vector or live attenuated viruses. The development of new vaccines is not limited to obtain the market authorization from regulatory authorities, but also to identify potentialities of co-administration with other vaccines such as influenza or coronavirus. In this slide, we can see a framework of the current vaccine trials with approval or expected market approval. And you can see that in the next 4 years, a lot of trials will be concluded. So there are many innovation in this field of vaccinology and in the field of RSV prevention. Another area of research focuses on improving the epidemiological understanding of transmission dynamics, especially among different age groups. We talked before about household outbreaks, but also transmission among geographic macro areas. It is important to acknowledge the role of research in deepened some environmental factors such as seasonality, variation of climate and climate change effect on transmission patterns. We must continue to evaluate efficacy and safety of immunization programs for pregnant women, but also for vulnerable population, especially the older adults. And we must evaluate the effectiveness, affordability, and accessibility of a large-scale vaccination campaign. Jesus before gave us a perfect example of need to deepen the effectiveness and cost of vaccination in specific population. We need to improve our surveillance systems, maybe creating advanced monitoring systems that use artificial intelligence to predict outbreaks and to assess the impact of preventive strategies. And last but not least, we need to work on evidence-based vaccination policies. To date, indeed, there is variability across countries. Most nations have not established targeted vaccination programs. There is a general recommendation in Austria about vaccination for all adults over 60 years. In Belgium, there is a recommendation of vaccination for adults, all the adults more than 15, but especially for adults over 60. In Sweden, there is a recommendation to vaccinate all the adults over 75 and all the adults with specific chronic condition from 60 to 74 years old. In Italy, il board del calendario per la vita, it is the vaccination calendar for the life, the board for vaccination calendar for the life, currently recommends RSV vaccination similar to Sweden, to all adults over 75 and to all adults with specific medical condition from 60 to 74. But RSV vaccination is not yet included in the Italian vaccination schedule for these people. Vaccination in all these countries, it seems not funded by the national health system. I have concluded my presentation, so I want to thank you for your attention.